North Dakota. Today, the North Dakota Department of Health confirmed 9 additional cases of the novel coronavirus disease, or COVID-19. First was a man in his 50s from Foster County. Second was a man in his 60s from Ramsey. Third, male in his 30s from Morton. Fourth was a male in his 50s from Cass County. Fifth was a male in the 50s from Cass County. That one is possibly travel. Woman, female in her 50s from Cass County. The ones that I named so far that were not travel or still under investigation. The next 3, again, which we view as important because the contact tracing has been completed. We're not able to identify contact through either another known positive or through a travel, but we have a female in her 70s from Ramsey County, a woman in her 30s from Stark, a woman in her 60s from Stark. All 3 of those last ones are attributed to community spread. So with the addition of Foster and Stark, we're now up to 10 counties on the map with confirmed COVID-19 cases, but there has been some question. After we announced a case in Dunn yesterday, there was a lot of activity on social media that was describing that an individual from one of those counties might have had a physical address there, but it was an individual who was actually living in Cass County but still had an address. We, of course, don't have access to that kind of information, so helpful that families or others that might have specific information about personal living areas may want to share that. That's great because they're getting the word out to their communities. But from a standpoint of maintaining the Health Information Privacy Act or the HIPAA laws, we're going to only be releasing county based on the address of which the person submitted that address when they applied for the test. So there may be some variances between when we name a county and where the person is actually living, but I was happy to at least see from the family that that one individual who's in Cass County is in isolation and has been that way since return from international travel and is recovering. So that's good news. Totals. North Dakota, we've got 1,955 tested, so closing in on 2,000. That's a plus 353 individuals from yesterday. We like the trend line because we want to see the number of tested continue to climb. But of course, 9 positive, including that brings us to the total of 45 individuals. In terms of hospitalizations, we're a +1, so up to 8 that are hospitalized from this disease. And of course, that means a question yesterday, none of the people that were previously hospitalized have been released. So again, we want to make sure that everybody is keeping those individuals in their thoughts and prayers. We now have received tests from 50 of the 53 counties. I think that leaves Slope, Billings, and Dickey as 3 counties that we at least don't have a test that's got an address from one of those 3 counties, but closing in on statewide testing. The good news on testing, as we've continued to work the supply chain on this side, we do have 1,155 test kits at the North Dakota Department of Health that are ready to be able to be sent out to facilities around the state. So if anybody's running short of test kits, contact our Department of Health. And we do have the supplies on hand at the lab for the ability to run 3,248 tests. And of course, we're trying to replenish that, but we at least have the ability to more than double the number of tests that we've taken in the coming days, if that many tests are recommended by health providers. In addition to that, knowing that we want to move from testing people in the thousands to testing tens of thousands of people in our state, one of the ways that we're going to be able to, in a more targeted way, make sure that we're creating the quarantine for people that are positive, and those people who've been in contact with positive cases. That's the way we can really slow the spread versus trying to get a whole state of which the majority of the people in the state at this moment are still healthy. Again, we can be more targeted and less blanket if we do more testing, and that is since we know that we're going to be in this for weeks to come, that we need to make sure that we're continuing to do everything we can to ramp up that testing. So we do have a task force that is assembling itself. So in addition to the great work that's already been done by our North Dakota State Lab, the small team there that continues to churn out these tests and work around the clock, we're also enlisting help from the private sector. And pleased to announce that Ross Manson, who's an executive at Eide Bailly, one of the senior partners there, and earlier in his career led the healthcare consulting practice at Eide Bailly. He and a team of other consultants from their group are going to be assisting the work that we're doing out of the Unified Command. And again, Unified Command being led by our State Health Officer, Mylin Tufte, and Major General Alan Dorman, who leads emergency services for North Dakota. Part of what we're going to look at is not just our own capabilities, but also the capabilities of our university system, because it's possible that we'll be able to convert some testing capabilities at UND, NDSU, or the University of North Dakota School of Medicine. In addition, I've been in contact again today with executives and the CEO, Michael Chambers, and one of the co-founders of Aldevron. We're fortunate to have in our state one of the top biotech firms in the world. Aldevron is certainly what you'd call critical infrastructure. They are working on providing testing materials to pharmacy companies around the world as those pharmaceutical companies around the world work to be able to create vaccines. So we want to make sure that Aldevron continues to do that important work, and they're doing that here in North Dakota, and could very well, they and their customers could be part of that global solution. But they are going to work with us, the executives from Aldevron, to see if they can also jump in and help us be part of this testing task force to see if we've got the equipment and the personnel to broaden out our ability. A vision for North Dakota would be that we could become one of the states that actually leads the way on the testing side, because this is something that we look to other countries, in particular South Korea did a fantastic job on testing, and at least so far in the U.S. We're not where we need to be as a country, and there's a chance here for North Dakota to lead.